Good morning, everybody, and welcome. Before we begin, I would like to acknowledge that we are gathered here today on the ancestral and unceded territory of the Squamish Nation, and just to express my gratitude that we can live, work, and play on lands that they've stewarded since time immemorial. My name is Patrick Weiler, and I'm the Member of Parliament for West Vancouver, Sunshine Coast, Sea to Sky Country, and it's a pleasure to be with you today for a really important announcement which will allow people living here in the Sea to Sky, in our province, and across Canada to access greater prevention, harm reduction, and treatment services. I'd also like to extend a big thank you to Squamish Helping Hands Society for hosting us today, along with Sea to Sky Community Services and so many others. Frontline organizations work tirelessly to provide food, shelter, and community to adults experiencing homelessness or who are at risk of homelessness in our communities. Here in BC, we know the critical role that organizations like these play in our communities. 7 years since the public health emergency related to the toxic drug and overdose crisis was declared, I've heard from so many people in my riding who've lost loved ones, and these are some of the most tragic conversations to have. Groups like Moms Stop the Harm are using memories of their children to fight for harm reduction approaches that is compassionate for people who use substances, providing safer supply and diverse pathways of support for all. And the evidence is clear. Overdose prevention sites not only help those directly impacted by the overdose crisis, but help improve community safety for everyone. In Canada's drug and substances strategy considers harm reduction, prevention, treatment, and enforcement together as pillars of a comprehensive plan to address the public health emergency. The overdose crisis is not a standalone. It's connected to affordability, housing challenges, existing social inequalities, and amongst other things. So our government will always take a whole of government approach to the overdose crisis and continue to support an evidence-based approach to saving lives. With that in mind, I'm very proud to welcome my colleague, the Honorable Carolyn Bennett, Minister of Health and Addictions and Associate Minister of Health, to the floor to make a very important announcement.
Thank you, Patrick. That's so great. And I forgot to mention that at Canada Day last week, I met your uncle and aunt, and your aunt gave the remarks, actually, that she'd prepared to come. So they're very proud of all you're doing, as well as proud of being your colleague who you contribute in an amazing way to our caucus, and your wise ways of both the brilliant policy mind and a hugely compassionate heart. We are very, very grateful for your service, and it is. I too want to acknowledge that we are gathered on the traditional and ancestral and unceded territory of the Squamish Nation, and grateful that the Mayor of Squamish, Armand Herford, is here with us as well, and all members of the community, and that this is about us learning from all of you, and being able to thank our host today, the Squamish Helping Hands Society, for the warm welcome, but everything that you do, and for the past 17 years. And I know we'll hear a little bit more from Lori, but it is about food and shelter. And I think that we were just at Foundry now, and to see really what BC Housing has been able to do by having programming meeting people where they're at, and we all know we've got to do more on housing, but I think it's really impressive to see, the main floor, low barrier, as we heard just now. So thank you for the pre-meeting, Lori, and we want to just really thank all of you, especially the people with lived and living experience, the people that can tell us how this is helping, but the doctors who explained really by getting this kind of help to people, how we reduce the visits to emerge, but also help be able to build that kind of peer support of those with living experience. And I really enjoyed hearing about the street degree and really how we know in terms of increasing the mental health literacy, increasing the availability of people who know how to use naloxone, how to do CPR, and who are really interested in these, what we are trying to do coast to coast to coast in terms of improving the public health of Canadians, but also the public safety, so that people understand that we understand really that we are, that by helping the people who need it most, that we are actually doing both things. So as Patrick said, we're here because we share the commitment to addressing the toxic drug and overdose crisis, which continues to take the deadly toll across the country. Last year, 2,300 people in British Columbia died of an opioid-related cause. And as you know, it's not just here in BC. In the most recent national data, there were 20 opioid toxicity deaths every single day in 2022 in Canada. But I think, as Patrick and I know, and as we heard at the meeting, this, in the debate in the House of Commons, wherever we go, this is no longer a they problem. This is a we problem. This is about all of us who know somebody or some family who's lost somebody to this crisis, and who and families that have been impacted by the crisis, and therefore we are trying to do everything we possibly can. And the announcement and the kinds of investments that we're making is to really be able to do that, investing directly in community, and then being able to prove the concept of what's working, what's not working, how do we fund what works, stop funding what doesn't work. And it was that the expert task force on substance use said that we had to make significant change with bold policy, and change that recognizes that substance use is this public health issue shaped by many complex factors, many of which are completely beyond an individual's control. Past trauma, access to stable housing and income. It is again for us to really help build the mental health literacy and the understanding of what trauma means to all Canadians. I think that we have begun, I think, to change the narrative, to be able to say we've been asking the wrong questions. It's not what's the matter with this person, but what happened to that person. And it is about understanding the psychic pain of residential school, or child abuse, or the physical pain of falling off a roof or being in a car accident, as we heard just now, and then being given not enough medication to numb the pain, or with psychic pain, trying to find self-medication to numb the pain until you can build that relationship with a trusted person that actually believes in you, wants you to stay alive, and can see the really potential in this life. And as we heard earlier today, and the benefit from getting to that place where you can help others on their journey. And so it is a matter of if we ignore the pain, if we ignore the fact that we are missing being able to find lasting solutions, because the pain will return. And if it's not dealt with, and it's not dealt with in a good way by people who care, that it is about isolation. It is about a lack of dignity. It is about people needing support, not judgment. It means they need community. It is connection that is the antidote to the kind of dependencies that we're seeing. It is about empathy and understanding, and no longer stigma. I think that we had an opportunity with COVID where more and more people were starting to talk about mental health and substance use problems. And maybe this is a time where we can see the stigma coming down a tiny bit so that people will feel that kind of compassion, or look beyond to the trauma, look beyond to the struggles that people have had. And I am very worried that the politicization of this is really getting in the way of helping people. That when you make judgments about people, that you further stigmatize them and make it more difficult for them to seek help. And I think that really does harm people's paths to both recovery and treatment. And that we need to understand that the polarization, I've heard this so many times from people who have now been well on their pathway to recovery or in recovery, that the polarization of harm reduction versus treatment is really unhelpful. And that we can't say we need this instead of that. We need both. But then if we're going to have treatment, we have to have the decent aftercare to be able to make sure those people no longer are alone and that they have community. And I think that is what we are trying to do with the kinds of funding, to be able to show that it is the pillars of education and prevention, harm reduction, treatment, and again with the mayors and with the law enforcement, that when that is necessary to deal with the people who are actually selling poisonous things to our communities. So it is, whether it's in the House of Commons or in Port Alberni this week, or that we keep saying there is absolutely no recovery for people who are dead. And I've been saying this for a very long time. When they kicked out that pillar of harm reduction in the previous government, and it was all about judgment, and it was all about politicians thinking they knew more than what internationally accepted policies ought to be. And so it is about keeping people alive long enough to be able to see the hope. And to be able to feel that there are people around them that care. And so that means that we have to embrace the full continuum of supports that include harm reduction in addition to the others. And these are the 4 foundational, internationally recognized pillars of substance use strategy. So, but it was interesting when we were in Portugal earlier this year, we heard about a 5th pillar, which is really what we're here to talk about today. It is about social reintegration, where we have to ensure that people aren't forgotten and that they are taken care of with housing, food, and other things, and are supported and able to continue on a healing path. And I was saying at the pre-meeting that in my hometown of Toronto, at the biggest teaching hospital in the country, that the CEO of the hospital is now investing in prescribable housing, 50 units for the people. 230 people were responsible for 15,000 visits to that emergency department. This is unacceptable, and we have a moral obligation to prevent the preventable. And that we have also the obligation to show that we need more health, so people need less health care. That's the only way, the sustainable way to our most treasured social program. So it is about really being able to invest in a community level, the organizations who are providing those wraparound services, and integral to seeing the life-saving results we need during this crisis, and for us to work with them as we're seeing in terms of where are the gaps, who isn't being served, what can we do in what we know we have to do in trauma-informed, culturally safe, and evidence-based approaches. So it is about organizations that have deep roots in community, who are able to earn the trust of their clients, and also incorporate and include former clients as trained as peers, trained as the kind of really members of a team that can make that low barrier entry into care really low barrier, because they're immediately dealing with somebody who's been there and had that experience. And so that, I think, is one of the big exciting changes that we're seeing now, in that it is about lived and living experience, and that the members of the mental health team and the healthcare team can't just be the people with letters after their name, and that we know that we need to be able to expand that. So today we have $20 million in federal funding. I didn't ask for the drum roll or whatever, Patrick, but and this is 42 projects across Western Canada through Health Canada Substance Use and Addictions Program, lovingly referred to as SUOP. And this funding will help improve access to prevention, harm reduction, and treatment services in here in British Columbia, but also Alberta, Manitoba, and Saskatchewan. Today, our host is receiving $785,762 for the Squamish Pain and Primary Care Program, and we heard a lot about that. And we, where's my friend that told us about it? His experience. Keith, stand up, Keith, because that was a pretty impressive story you told us in terms of your journey. So you're a shining light, I think, a lighthouse to lots of people in terms of knowing how you described that with that pain program, you're now able to help other people. And so it is members who helping maybe homeless or at risk of homelessness, experiencing pain, chronic disease, mental health challenges, using substance or at risk of using substances. Some projects will provide the harm reduction services, the injectable opioid agonist therapy, including hydromorphone or diacetylmorphine and fentanyl patches for those with severe opioid use disorder. Other projects will provide recovery coaching and treatment, as well as supports for groups disproportionately affected by substance use harms, such as Indigenous peoples and youth, supports for people experiencing chronic pain. When you look at the list of the projects, you'll see that from the Blood Tribe Kainai in Alberta, that there are many organizations and approaches that really are being built bottom up and then are successful in their grant application. So we had a opportunity earlier this week in Victoria at the UVic SUOP project, which is really focused on the managed alcohol program, which we've seen a number of very successful programs across the country, which is introducing cannabis as an alternative to alcohol in a safe way that is evening out the usage and taking people out of that very dangerous level of a drug, alcohol, that is killing way too many people in our country. Of course, today's investment, while important, is only one of the broader commitment to improving healthcare for Canadians, including increasingly access to timely substance use and mental health services. As we were talking about earlier today, that the Prime Minister's announcement on February 7th, where they'd identified the 4 areas that will be part of the action plan for all of the provinces and territories, is really what we're seeing in real time here. Meaning, how many Canadians will have access to primary care? And will that include mental health and substance use adequate programming? Secondly, that, as Lori said, the humans delivering the care to humans? Do they have the mental health and supports that they need in order to be able to keep doing the important work they need? And we have to be looking after the people doing the work so that we end up with the retention that we need, and to be able to recruit great people to want to work in this area if all they're seeing is people burning out. So how do we do that? And so then on the third pillar is mental health and substance use, and we need your help sorting out what are the indicators for community, because we have not bad indicators in hospital, wait times, those kinds of things. We have indicators in public health in a certain way, but community indicators are very weak, and we would love your help knowing what would be the kind of indicators you'd want provinces and territories to include in their action plan. And then the fourth pillar is about that real transformation. Are we using technology, as we heard with the virtual foundry, with the kinds of programming that we know need to be, but also, do people have to really tell their story 10 times? Do we have people's intimate histories floating around in doctors' offices on fax machines? Like, this is not okay. And so, and my favorite is that patients have to have access to their own record. That is the way that we find the mistakes and the prejudice and make it a much safer approach for Canadians coast to coast. So il s'agit de sauver des vies et de mettre les gens sur la voie de la guérison. Et il n'y a rien de plus important que cela. It is that we know that unless people get the supports they need and are heard, that we need them heard. And that's why today at Foundry, we know where the youth-led setting of priorities is hugely important in terms of people having voices, that people will be disproportionately impacted. We know that, as certainly at the summit last fall with Minister Haiju, we know that the Indigenous-led programs are the ones that really can make a huge difference in the lives of First Nations, Inuit, and Métis people across the country who are already facing considerable barriers to care. So, as we've heard, every tool in the toolbox, from safer supply to the fact that the Carpenters Union in Victoria is handing out naloxone to all its new members, that we want everybody to understand how to use naloxone just the same way as we want everybody to know CPR. That how do we use the opioid agonist treatment to longer term treatments and recovery supports, and how do we build on that fifth pillar of social reintegration with social housing and that kind of wraparound supports to the housing that we know we need for the complex, those with severe mental illness and substance use. So I just want to thank all of you for being here, and everybody here committed to us finding a better ways of doing things. As the Prime Minister always says, better is always possible. We want to help work with you to, both here in British Columbia, across Western Canada. It is, you are on the front line of the work to address not only the overdose crisis, but the mental health literacy, the trauma-informed nation that we need as you support the people in your communities to lead long, healthy lives. And thank you. It's been an honor to be with you this morning.
Well, thank you very much, Minister, and also a member of Parliament, for a number of my family members in Toronto, for the wonderful announcement today, and also for the really wise words about just the scale of the crisis that we're facing here and what we need to do on a go-forward basis. And I think it's incredibly appropriate that we're here in Squamish today and announcing two projects in Squamish that are both providing low barrier access to health services, for whether that's youth or whether that's people more generally in the community here in Squamish, because it is really about community. And so with that, it's my pleasure to invite to the podium our new director here, at Squamish Helping Hands Society, Lori Pyne, to tell us a little bit more about the work you're doing.
Thanks, everybody. I'm honored to be here on the ancestral and stolen territory of the Squamish Nation. I love being in this beautiful outdoor space that we've created here. Creating safe spaces creates more resilient communities, and I am centered and very connected to this land right now, and it's a great place for me to reiterate very similarly what both my cohorts here have said. I was really glad to hear that public safety came out in both of your speeches. It's really important to recognize that when participants and caregivers and community are safe, that everyone feels safe and everyone will be more resilient and stronger because of it. This funding that we've received is critical funding to improve the quality of lives and quality of people. And if we improve lives, we ultimately improve community, and that's why we're all here. We wouldn't have community without all our community partners, and I deeply appreciate some that are here today. We make this place safe because of all of us. The RCMP are here today. We work very closely with the district. We work with Vancouver Coastal Health. We work with multiple other community service partners and up and down the corridor. I would be remiss without talking about how critical this funding is, and to spend this funding, it requires amazing humans. I have gratitude for these humans that care for other humans. There's 61 of them here at Squamish Helping Hands, along with many other contractors. And I wanted to read everyone's name out. I won't, but it's important for everyone to know these caregivers and what they give to this community every day. I want to talk about mental health a little bit, and I just want to reiterate that mental health includes physical health, it includes spiritual health, it includes social health, and it includes financial health. And we're trying to bring all these things here and under one roof. It's something that all of us work towards every day, supporting all the different participants in all those facets of health. I want to talk about trauma-informed care. The minister's exactly right, and just for the jargon that people may not understand, it's not what's wrong with you, it's what's happened to you. And we need to speak to our colleagues this way, we need to speak to our community this way, we need to speak to our participants this way, our clients, our ministers. It's what's happened. That's what's important. The pain program here at Squamish Helping Hands, I want to read a quote by an amazing human, Rochelle. She is a coordinator here for the pain program. Pain is complex and influenced by trauma, injury, stress, systemic conditions, and poverty. And I'm sure everyone here knows someone that has experienced one of those things. The thing about the critical funds that we've received is it makes the care that we give equitable, safe, and non-discriminatory. It's very low barrier, and it's open to anyone that needs it. We've been doing it since 2021. We have some amazing doctors. We have amazing advocacy on our team for bringing more services under one roof. I have a quote I'd like to read by a few of the participants that have taken part in our care. I would reiterate Mr. Bennett's comments about it's the people with living experience that are really the experts here. Here's some feedback. It was really useful for me to recognize some of the triggers and challenges that impact my life. Also, I learned really useful tools to identify my body responses to some situations and how to prioritize and listen to what my body is telling me and give it what it needs. I now have information and tools to help manage my pain. Another shares, I think this program has impacted me positively. It has been really beneficial for me, and I am currently using the tools learned from that. I feel grateful for the opportunity of being part of the program, and I really hope to have another chance to access these services again. I'd just like to close with deep gratitude, again, for this funding and for recognizing that this funding is necessary. I have deep gratitude for my team here today, and I have deep gratitude for First Nations, and I just want to share something that I learned from Chief Robert Joseph of Squamish Nation. He suggested that we should lock eyes with people more often. And I would recommend that one of you lock eyes with someone today that you haven't locked eyes with before. Thanks.
Well, thank you very much, Lori, for that those wise words as well. And with this, that concludes the speaking portion of our event. From now, I will hand it over to our moderator that will be able to take questions from the media.
Thank you, MP Weiler. So we will now proceed to questions from media here in person. Nous allons maintenant passer aux questions des médias présents ici. If you wish to ask a question, I just ask that you please state your name, media outlet, and to whom your question is directed. And you will have the opportunity to ask one question with one follow-up. So we can proceed to the first question.
Thank you. I'm Jennifer Thuncher with the Squamish Chief. Thank you for being here today. You mentioned, Minister Bennett, the Portugal connection. And before coming here, I talked to a mom whose son died of the toxic drug supply less than a year ago. And her question she wanted me to ask was, when you mentioned Portugal, what about more safe supply and deregulation or decriminalization? Where are we with that?
I think it's a hugely important question, and I think that we know now with safe injection sites that we have overturned 47,000 overdoses really since 2017. We know that for 40 years people have been using methadone safely, and 20 years of Suboxone, and more recently Sublocade, but those medications aren't actually able to substitute for what people are getting on the street now with fentanyl. So you will see fentanyl patches being used, you will see other aspects of safer supply, you'll see the hydromorphone, the diacetylmorphine injectable, Dunkin, or some of the other areas. So we are, and I think that we are also seeing CIHR evidence that this works, that people actually describe a different life without the hustle, with them actually being able to get on with their lives. And so the research, say with Dr. Tu at Kalalalalem in the downtown east side, really with the work of an elder or a knowledge keeper that you can, and safe supply, that people do not have to go to the street for their drugs in the same way that they used to in terms of topping up or being at risk of the toxic supply. So we are working with the safer supply community. Shannon Nix, who runs the SUAP program from Health Canada, has an advisory committee on safer supply. We are working with really all of the practitioners. And I think that what's happened here in British Columbia with the College of Physicians and Surgeons giving a very, very clear guidance document on for the prescribers, that we know that this is working for so many people, and I think that the research is showing that we need to be able to make it available in more parts of Canada.
Do you have a follow-up, Jennifer? Okay. So thank you, merci. We will now proceed to questions from journalists online via Zoom. Nous allons maintenant prendre des questions des journalistes via Zoom. Over to you, Marie-Pierre.
Thank you. Now, if you are a reporter on the Zoom and wish to ask a question, please use the hand raising function. We ask that you limit yourself to one question and one follow-up. We also ask that you modify your Zoom handle to reflect your name as well as what media outlet you are working with. Unless I have stated, please indicate your name and media outlet before posing your question as well. We will start with a question from Michelle McDougall.
Hello, everyone. Can you hear me from Manitoba? Excellent. I'm sorry if I missed, is there a breakdown of the funding that will be going towards Manitoba?
Yes, there is. And you'll find it in the backgrounder that came with the press release. Let me just look for Manitoba here. I guess we're moving west to east, so let me just get to Manitoba. But
We can provide the details later too.
yeah, we can get to that. Where is it okay? Well, oh, there's one that Métis. Oh, I know that Manitoba Métis Federation has a opioid education addictions outreach program in Selkirk. There is a program, a meth pipe pilot project for people in Pine Falls and Selkirk. The Manitoba Harm Reduction Network is getting that. Ramp Clinic, the mobile and virtual service in Winnipeg. Nine Circles Community Health that has done such great work over the years on HIV/AIDS is getting 420,000. John Howard Society in Manitoba and the Ray Substance Use Harm Reduction Education Program is getting additional money from what they've had from SUHOP before.
Super. Thank you so much for doing that for me. No follow-up.
Thank you, Michelle. Next, we will take a question from Stuart.
Hi there, Stuart Benson from the Hill Times. My question is also for Minister Bennett. Just we're approaching, I guess, the 6-month mark of the decriminalization pilot project in BC. I might be a little early for a full comment on how it's going, but I'm going to ask anyways. I guess what would your evaluation be on how it's going? And since you did mention Portugal, and to compare to that example, there's a lot of very intensive sort of frontline outreach and and in some cases, a lot of mandatory interventions to refer people to different programs, I guess, like the one we're here to announce funding for. So one, how do you think the program is going? And do you believe that there's enough resources and that kind of outreach to make sure that the pilot is successful or continues to be, if it is?
Yep, thank you for that. And as you know, that in terms of the indicators on both public health and public safety, as Lori said, the BC Centre for Substance Use is monitoring very carefully the indicators that they've chosen. And we hope by later in the summer, there'll be some dashboard available to show what's happening, and that we will also be able to move on any concerns people have. I'll say right now that we know that some of the public use has been concerning to some of the municipalities, and so we are working with our partners in law enforcement and with the government of British Columbia to address any issues that are forthcoming out of the data. So we're going to measure what's going on and the concerns but I think that what we want to see is the stigma comes down, and I frankly am concerned that some of the stigmatizing language and names that is coming is very unhelpful in terms of what people need and the compassion that they require. And I just think that we all need to be on the same page on this in terms of how we actually help people and how we take seriously the bold action that the government of British Columbia has taken, and how we actually get accurate information coming out of this pilot. On the Portugal piece, it was really interesting. I mean, when we met with the Dissuasion Commission, that there really is not mandatory treatment. People are offered all of the supports and services they can have in housing and employment, and they are sort of asked to report in how they're doing, but people are not being sent back to the criminal justice system. And so this is, so I just was so impressed. And as you say, how impressive it is they've taken this social reintegration approach, and how they are able to meet people where they are. I was very impressed with one of the mobile vans where people come to the mobile van to get their methadone, and there's a little laptop in the van that has their name or their nickname or however they prefer to be identified. And there they get their meds for their Hep C. They get the meds for their HIV/AIDS. Some of them get their antipsychotic meds. And so that there's a way of actually meeting people where they are at, where you're actually having people complete a Hep C treatment. And that same approach was used in the shelter that we visited. And so I just think we can learn from them in terms of the social integration part, and the fact that 20 years ago, 1 in 10, just 1 in 5 families, I understand, had a loved one who was addicted to heroin. And so the community decided that they wanted their loved ones to get health and social services, not enter into the criminal justice system. And so there's also a population attitude to this, and that is compassionate, and because it touched so many families, and that's what you feel when you're there. It really is about how do we get the best help possible to this person who is struggling.
Do you have a follow-up, Stuart?
Sorry, I was muted there. Yes, just I guess the final question is, if this program does, after the 3 years, prove successful and returns the results you'd like to see, especially with the reducing stigma and all the other benefits that we're hoping it will, is this something you'd like to see expanded to other provinces, or maybe a more across the board measure at the federal level?
Well, again, it's a matter of building these bottom up with willing communities. We're obviously working with the City of Toronto on their proposal, and certainly the last time that we were in Yukon, I think that the government there is very concerned about their overdose crisis there, and so we will work with the communities that are able to really have that ramp up the health and social services to meet the needs of, if we're saying we're going to move people from the criminal justice system to the health and social services, those health and social services have to be there. And that's why I think working with the province of British Columbia has been very good, because they've really wanted to ramp those up and be able to deal with the people using drugs in a compassionate and with dignity, while we know the drugs themselves are still illegal. So it's the people that we want to help not be criminalized. And so that I think has been some of the misunderstanding of what really this project is about.
Perfect. And next we will go to Adam Zivo from the National Post. You may go ahead.
Hello, Minister Bennett. So I just want to preface my question. Dr. Nikki Matthew had given a presentation in late May in which he shared a video of a patient describing how diverted hydromorphone from safer supply programs was being sold in nearby Indigenous reserves in the Vancouver area. Earlier this week, I interviewed a patient who described the same thing happening in reserves in southwestern Ontario. You had spoken about the importance of protecting vulnerable communities from opioid addiction. what is your government doing to fund initiatives or research that protect Indigenous communities from safer supply diversion?
Well, thank you, Adam. And I do think that what we're doing is creating the evidence that is about many patients and the benefits that many patients have received in terms of whether it's CIHR or whether it is the kind of creating of evidence of the people providing, prescribing, but also the lived experience of the patients, that this is very important. I think that the anecdotal one or two, it's what we used to call in medicine, last Tuesday medicine, that because a patient had an unusual response to a certain drug last Tuesday, that I'll never use that drug again. That is not the way we practice medicine. We practice medicine by what is in the evidence. And so I think that we know that diversion can be a problem, and we are working on it, as are all the prescribers, that they want to make sure that it's their patient that is benefiting from this, and we will continue to work. But it is about saving lives. And when you listen to the people who are now able to use safer supply, their lives have changed dramatically. Without the hustle, they are safe. And I think that this is what's Mom Stop the Harm, and so many people who've lost a loved one. I mean, you heard the first question, Adam. It was from somebody who'd lost a loved one. And that's what we are trying to do. We need people who have a dependence to be able to have a regulated supply, such that they can be stabilized, and they are on what they call in Germany a substitution therapy, the same as we did with methadone, Suboxone, Sublocade. It's just that those drugs don't work for the drugs that are on the street right now. So we are working with every bit of evidence and careful approach. But I think that it would be really important to talk to the people who are on the front lines of this, doing the prescribing, but mainly the people in the programs are the ones that know their lives are being saved and have been dramatically changed by this approach.
Do you have a follow-up, Adam? Perfect. So I will hand back the moderation.
Sorry. Yeah,
sorry.
My apologies. So my follow-up question here is that like a majority of the studies which support safer supply are low-quality qualitative studies that rely on interviews with patients in safer supply programs, aka anecdotal evidence. So there seems to be a bit of an inconsistency here about whether anecdotal evidence is valid or not. Either it's valid and we accept anecdotes and there's evidence of benefits of safer supply and significant evidence of diversion, or as you said in your response earlier, anecdotal evidence is not acceptable, in which case the majority of research in support of safer supply is not valid. So which one is it? Can we accept anecdotes
Adam,
or not?
when you talk to one person, then it's an anecdote. When you have professional clinicians and researchers doing qualitative research, that is evidence. When you've got a number of people speaking and where actual clinicians are and researchers like CRISM at the CIHR, I think that the people working in this area know, and particularly the people like Guy Filtella or the Mom Stop the Harm, the people who know they would not be with us today if it hadn't been for safer supply. So I really encourage you to talk to the people on the front line of this, not go gather anecdotes of the exceptions.
Thank you very much. And I will be handing the moderation back to Deanna on site. Thank you very much.
Thank you. So this concludes today's event. Thank you everyone and have a wonderful day. Ceci conclut l'événement d'aujourd'hui. Merci et bonne journée.